Hi guys, so I haven't done a video about the MRCS for quite some time, and the reason for that is that I've actually been focusing on my exams. So what you're seeing in the background is actually my excerpt from, or a screenshot of the email that was sent to me from the Royal College of Surgeons. So at the top you see my name, which is Dr. Misha James Lindsay Cisnet, my exam number, which is 29, and they were informing me that I passed my MRCS. This was in February this year. So as you can see, it says, "Dear Dr. Cisnet," and then they said, "I am pleased to inform you that you have been successful in intercollegiate MRCS Part B." So this is a breakdown of the actual grades. So you see right here, that's the applied knowledge, and here is the applied skills. And the maximum score for the applied knowledge at the time was 160, and the applied skills is 200. So for my exam, the applied knowledge was actually harder, as you can see from the grades. So the pass mark for the applied knowledge was 109, and I got 110, so I barely passed the applied knowledge. But the applied skills went a lot better, which was 132, and the pass mark, or the mark that I achieved, was 147. So why did I fall along in the applied knowledge? For me, when there were certain stations that I found literally just threw me completely off. And at the time, despite the fact that I know what they are now, I just found that in the exam, under the pressure, I wasn't able to answer as well as I could. So I'm just thankful that I actually passed that part. So for the applied knowledge, they have how it is set up is in a circuit. So the circuit goes from, it's about, at the time, maybe about 20 stations, and a couple of them were rest stations. So I came to the station that it was about carcinoid syndrome, and I mentioned this in a previous video. At the time, in the exam, I did not remember anything to do with carcinoid syndrome, despite the fact that I knew you had to test the urine for catecholamines and vanilla mandelic acid, things like that. But in the exam, I didn't remember that. So there was one station that literally I probably got 0 on. Now, despite the fact that I didn't do so well on that station, I pulled back up I had to settle my nerve and move on to the other stations and made sure that I performed well in those. But that station was a bit difficult, as well as there was a station with a telephone call. That station stands under my mind because when I picked up the phone, they asked about a patient that was a post-operative patient that literally was starting to as you would say, desaturate, have respiratory difficulties. They asked us to assess and then call how it was set up is that you have a table with the vital sheets and the clinical notes, and they ask you to assess this patient. So it went pretty okay initially. But one of the major things that I think I was marked down for was that I actually forgot to mention that you have to test the patient's calf to see if they have any calf tenderness. That's a big mistake, big mistake. Might not have been completely failed on the exam, but that is a life or death mistake. So that station didn't go too well. All of my other stations were, I found no problems with them for the most part. So that's probably why I got such a low mark in the applied knowledge. Now in the applied skills, that was an actually enjoyable session for me because a lot of it was, well, for one, there was a chest tube station, or placement of a chest tube. Then another one was ATLS, examination of a hernia, a cardiovascular examination, lots of things that came that were like second nature to me. So that examination was not as challenging, but two major stations threw me down the applied knowledge. But I'm just thankful that I passed, and that is behind me. So I'm no longer Dr. Misha James Lindsay Cisnet. I am Mr. Misha James Lindsay Cisnet, but still just very humbled to be a member of the Royal College of Surgeons, Edinburgh. Keep your questions coming, and all the best for your exams.